So today in our series on neck lifting terminology, we're going to talk about the deep neck structures. So as we discussed before, the deep neck structures are all the things that are adding bulging behind the platysma muscle, the hammock muscle that makes up our neck. So what do we see when we go in there as surgeons? When we lift up the muscle and look behind the hammock, we find what's called subplatysmal fat right here in the center. We find anterior digastric muscles that come here that can bulge, submandibular glands, and other tissues in that area that can also be enlarged and full. So when we're doing deep neck work, we're working on all those things and we're doing them in a very artistic way. So how do we do that? We've learned that you do not remove a lot of the excess fat right in the center. It sounds counterintuitive. People say, I want this bulge gone. But if you go too aggressive there, you can end up sucking this area in and getting what we call a cobra neck deformity, where it looks hollow in the center and winged on the side. The digastric muscles here are muscles that help hold the neck up, but they get large as we age, and sometimes they can cause a bulge here and thickness in our neck. So we identify what's truly a bulge, and what's not, and cut them down. We don't remove the whole muscle, we just trim them down so that they're right size and shape. And as we discussed before in our previous video, reducing the submandibular glands will also create a smooth U-shaped hammock here. So those are the structures. You can't liposuction the fat there. You can't liposuction the muscles or do anything else to the glands like stick them up. You have to sculpt them away, take some of the weight off the hammock of the muscle, so when the muscle lifts, the deep neck looks beautiful.